So my name is Dr. Peter Wood. I'm an obstetrician and a gynaecologist here at the Sydney Venus Hospital, and I've been working here since 2009. There are various stages of labour. There's sort of the early pre-labour stage. There's the first stage of labour, which while the cervix is dilating until you become fully dilated. Then there's the second stage, which is when basically the baby is birthed. And the third stage is when the placenta comes out. But what can a woman expect when this all happens? You may get these early contractions, which could be random and coming and going for a few days before birth. And this is very normal. If you're at all worried, don't hesitate to call the birthing unit and speak to one of the midwives, and they can advise you as to whether they think it is proper labour or whether it's a pre-labour. One of a couple things might happen to you, which is variable from person to person. There's no way to predict what's going to happen. You might break your waters at home or in the car, or if you're lucky, at Woolworths, which has happened to one of my patients. If your waters break, you should call the birthing unit, and normally it would be appropriate to come and get checked. Or you may lose a mucus plug, which is kind of like this mucus and blood, looks a bit like jam coming out, and that is a sign that your cervix is starting to change and things are likely to happen soon. Doesn't mean you have to rush into the hospital at that point, and it may be a small amount or a large amount, and again, if you're all worried, just call the birthing unit and talk to one of the midwives. But if the contractions are then started, depends on where you live, but if you're if you live within 15 minutes of the hospital, we generally recommend that when the contractions are about 3 or 4 minutes apart, now that's measuring from the beginning of one contraction to the beginning of the next contraction, that length of time, 3 or 4 minutes, and the length of the contraction is about 1 minute long. When it gets to that stage, you should possibly think about coming to the hospital. And again, before you leave home, call the midwives to let them know you're coming in. Don't forget to bring your yellow card or your antenatal health summary and any of the other information that might be relevant to you, as well as your PAG that you've already packed. Next stage is when you arrive at the hospital, and it depends on what time of the day where you should go. If it's between 6 a.m. and 10 p.m, you can just come into the main car park and follow the lifts and the signs to level 11 and follow the signs to the birthing unit. If, however, it's between 10 p.m. and 6 a.m, all those doors are locked, and the best way to come in is via the emergency department. And there's a system there, you front at the front desk. They usually know that you're coming in because it's pretty obvious, and they'll give you a wheelchair and help you get up to the hospital. What happens when you get to the birthing unit? Well, it depends on every situation. Every situation's different and what your personal needs are. But you'll meet your midwife, they'll show you the room, they'll assess you, observe you, listen to the baby's heartbeat, and from there on, they'll help you manage the labour and in consultation with your obstetrician. First stage of labour is defined as when your cervix is beginning to dilate to when the cervix is fully dilated, or 10 centimetres. That stage is often the most difficult to manage because you're just waiting. And there are plenty of things you can do naturally to help. Sometimes that happens at home, sometimes it happens in the hospital. And things you can do is to walk around, sit on a football, sometimes getting in the shower or even labouring the bath can sometimes help to manage that stage. Some people need extra help, in which case some analgesia such as nitrous gas or narcotics such as morphine or even an epidural may be required to help you manage that stage. Everyone's birthing experience is different, and you shouldn't compare your birthing experience to somebody else's birthing experience. And that's really important. And you will be supported by the midwives here, so that no matter whatever happens to you, it should still be a positive experience. The next stage of labour is when you're fully dilated. Now there's kind of an active and a passive stage to this stage. The passive stage is basically waiting for the head to descend in the pelvic cavity and to approach the pelvic floor. That again is just a process that needs to take time. It may be very quick for some people. Often this transition stage happens in there where the woman suddenly becomes very fearful or just wants to go home or it just finds it very difficult. That's a usual sign that we know you're getting really close. And then normally when the head then hits the pelvic floor, this involuntary desire to start pushing happens. It's quite amazing when that situation happens. And that's the active stage when pushing the baby out. During your birthing process, Here at the Sand, there's many options to help you. We talked about shower. All the rooms have bathtubs. Some of them have birthing pools, and labouring in the bath is an option which can really help some women. And again, this is where the midwives will support you and your obstetrician will support you and help you through that stage. Once the baby is birthed, then there is the third stage of pregnancy, which is when the placenta needs to come. So that stage, generally we try and put the baby on your skin. You have skin to skin with the baby. That promotes breastfeeding and it helps release oxytocin. There's generally an injection given as well of oxytocin that helps to encourage the placenta to come out and reduce your blood loss and reduce the risk of a postpartum hemorrhage. During this time, the father has a very important role to support his partner during this process. And it might just be holding her hand, or it might be rubbing her back or getting her water, but just by being there and believing in her and supporting her 100% is one of the key things that helps women birth successfully. All of the midwives here are very experienced and they really want to help you have a positive birthing experience no matter what your particular goals are. And we here at the Sand just want to invite you to discuss your plans and wishes and desires with the midwives so that we can really meet your needs.